What I want to go over today is the deductible. And a lot of Medicare beneficiaries, maybe even you, are going to the pharmacy now that it's January 2025, and you may be seeing that your medications are costing you more than what you actually expected. And this is because a lot of health plans actually implemented a deductible for 2025 that was not necessarily in place in 2024. A lot of this stems from the Inflation Reduction Act and some changes that occurred. So there's no more donut hole in 2025. There's a maximum out-of-pocket limit of $2,000 for all Medicare beneficiaries, where in 2024, it was about $3,200. So therefore, plan sponsors made some adjustments to benefits because of some of these changes. And one of the levers that they used was implementing a deductible on plans that maybe in the past did not have one. And so when you're going to the pharmacy and a pharmacist, I know you may be being told that you hit the deductible, but you're like, man, this seems to be expensive. This time last year, I didn't have no deductible, and I just paid my standard $50. And then it sounds to you like you're paying what you were paying when you were in the donut hole. Okay, so I know it sounds like it's a little confusing, but what I want to do is I want to go over what the deductible is, how you calculate it, and how you can know in January if your medication is being subject to the deductible. All right, so I'm going to share my screen, and we are going to use a Humana plan this time. Okay, so I have already gone in and I put in our drugs. So these are the drugs that I've put into the plan finder. And so what we're going to do now is we're going to use this Humana plan that has a deductible of $350 that we can see here. And so we're going to scroll down, and I'm still on the plan finder. I'm still on Medicare.gov. And when we get into here, here's all of our drugs. And then this is saying these are the yearly drug costs. And so you're going to pay for the Carisoprodol, the Januvia, and the Ozempic. And the total out-of-pocket is about $690.97 for the year. And that's with somebody starting this plan February the 1st. Okay, so what I want to do is I want to show you where if you filled all these prescriptions in February, the cost is going to be $391.63. All right, this is going to include the $350 deductible that comes with this plan. Okay, so here's the drug deductible. You got to pay that first $350. Now, the deductible does not always apply to every single tier of drugs. And here's how you can see this on the plan finder. What happens is if you go down and you expand out the pharmacy, it says cost before deductible, cost after deductible. If the cost before and after the deductible are the same, then that means that drug does not apply to the deductible. So like, for instance, alprazolam is no charge before the deductible, and it's no charge after the deductible. This Carisoprodol, on the other hand, is $12.04 before the deductible. It's $5.78 after the deductible. So that tells me that Carisoprodol applies to the deductible. This Januvia is $556 before, $47 after, so it applies to the deductible. And so another way, when you scroll down, Carisoprodol is on tier 4. Your alprazolam, your ezetimibe, hydralazine, those are on tiers 1 and 2. And usually most of the plans have their generic drugs on tiers 1 and 2, and they usually do not apply to the deductible, but it is plan specific. And so for this plan here, I know that Humana is not having a deductible on tiers 1 and tiers 2. There's only ones on 3, 4, and 5. Okay. Another thing up here, you see tiers 1 and 2 are 0. So if they're already 0, then of course they're not going to apply to the deductible. Okay, so we have a deductible of $350. And then we're going to use the Januvia as an example. And the cost of the Januvia is $556.31. Januvia is a tier 3 medication, and the copay for tier 3 medications after the deductible is $47. So it's tier 3, and that is $47. So how are we going to get the price of what the Januvia is going to cost you when you get the first fill in February? So because the price of the Januvia is more than the deductible, if Januvia is the first claim that you actually fill in January, you're automatically going to pay the first $350. Okay? And then you're going to have to pay the tier 3 deductible because there's still money left. So there's a difference between $556.31 and $350. So you're also going to have to pay the $47 cost share. And so that means the cost of the Januvia is going to be $397 in February, because you're going to satisfy the entire $350 deductible, and you're going to pay the tier 3 copay. So it'll be $397 for the Januvia in February, if that is the very first prescription that you fill with your plan come February the 1st. Okay, so I just told you what the cost is going to be. You're not going to see, so well, Renata, this says Januvia cost is $556.31 on the plan finder. That's because the plan finder does not take into account how much the actual deductible is. The only way the plan finder, the only thing that the plan finder is showing you here is that you're paying 100% of the cost of the drug until you actually reach the deductible. What I just showed you on how to calculate it is how you actually determine how much you're actually going to pay for said Januvia. If your plan does have a deductible and you are having trouble paying that deductible whenever you go to the pharmacy, I want you to recall that for 2025, there is the Medicare Prescription Payment Plan. That is one of the reasons why CMS, the Centers for Medicare and Medicaid Services, put the M3P or Medicare Prescription Payment Plan into place for 2025 to give you flexibility to spread those payments out across the year. So let's just look at it real quick. I don't know if these are the same drugs because I apologize. I forgot to go over this piece originally, but this is the Humana plan. The drugs are different, but there was a $350 deductible. And if you go to the pharmacy in February for this one and the drug cost is $380.04, and you're like, that's just too much for me to be able to afford all at once. Remember, the Medicare Prescription Payment Plan, you can spread those costs out over the year. And here's what that would look like. So in February, instead of paying $380.04, you would pay $181.82. March, you would pay $33.92. April, $49.59, and for the rest of the year, about $67. So that's an option for you to be able to afford these deductibles that we haven't seen in the past. You can use the M3P program to spread those costs out across the calendar year. All right, so what we're going to do is we're going to look at the Carisoprodol. And the Carisoprodol retail cost is $12.04. If this is the very first prescription that you fill of the year, you remember we have a $350 deductible that we have to meet. So because the $12.04 is less than the $350, meaning you have not yet met your deductible, you're going to pay the full cost for $12.04. All right. So then you got to take the $350 and minus the $12.04. And when you do that, you get 96. This is going to be $337.96 is now what you have remaining as your deductible. And so let's say we used the Januvia example. So let's say the pharmacy processed your Carisoprodol first, and then they came in and they did your Januvia prescription. Okay, and so our Januvia, remember, was $556.31. The Januvia is the second prescription that the pharmacy fills. So this was the first one. This is the second one. You're going to then have to pay the first $337.96 because you got to satisfy your deductible. So you do the first $337.96. You already know there's a difference between the $337.96 and the $556.31. So you're automatically also going to have to pay your $47 cost share, copayment. So therefore, the Januvia is going to cost you $384.96 because you had to meet what was left of your deductible plus the copay because there's still a difference between those two. All right. And then the plan is just going to pick up the rest. So this is how you are able to calculate and know what you're paying is a part of your deductible. And then once the deductible is satisfied, when the third prescription comes through, let's say for the Ozempic, you're just going to pay $47 for the Ozempic because you've already satisfied your $350 deductible. All right, so the deductible can be confusing at times, but I promise you, if you just ask your pharmacy what the breakdown of the cost is, sometimes they'll be able to tell you. I know for sure Walgreens can see how much of it went towards the deductible, how much of it was how much of your deductible was actually left. So you can actually ask your pharmacy if they do not know or are unable to tell you. You can always call the number on the back of your insurance card, and they'll be able to break down everything. They can tell you how much your cost shares are. They can tell you how much you have left in the deductible. They can even tell you what the claim you just filled, how much of it went towards the deductible, how much of it was your copayment, etc. All right, so hopefully you found this video very helpful. Just know that once you meet the deductible, you go to paying your copays after that until you reach that $2,000 max out of pocket and you pay nothing. And remember, if you haven't watched the other video, a lot of people will not even meet the $2,000 out of pocket before they're able to take advantage of actually meeting $2,000 out of pocket. And if you want to know more about that, please watch the next video up here, and it will teach you all about what I'm saying about the $2,000 max out of pocket. So hopefully this was helpful. Drop some comments below, and I'll see you in the next video.